Case 34. While doing a rotation in Ghana, a medical student encounters a patient who has been having nearly continuous high-grade fevers with occasional chills and sweats. Physical examination reveals a palpable spleen. A drop of the patient's blood placed in a copper sulfate solution reveals anemia. Over the next few days, while waiting for medication to arrive, the patient's level of consciousness waxes and wanes, and he is somnolent at times. What is the most common diagnosis? Malaria due to Plasmodium falciparum. The symptoms give a clue as to the species. The patient's altered mental status is consistent with a diagnosis of Plasmodium falciparum, malaria, since this is the only strain that commonly has cerebral involvement. The patient's continuous fever and irregular chills and sweats are also characteristics of Plasmodium falciparum, malaria. Early in infection, irregular fevers are common in all types of malaria, but the fever can become periodic in well-established cases of non-falciparum disease. For example, P. vivax and P. ovale cause episodes of fever, chills, and sweats every 48 hours. With P. malariae, these episodes occur every 72 hours. Splenomegaly is a common finding in malaria due to work hypertrophy from increased red blood cell breakdown. What phase of the microorganism's life cycle results in the development of anemia? Red blood cell lysis occurs during the erythrocytic cycle when the products of asexual replication inside the red blood cells, the merozoite form, are released. The immune response to the merozoites and resulting cytokine release is responsible for the fever, chills, and sweats. What are the likely peripheral blood smear findings? A PBS is likely to show ring-shaped trophozoites inside the red blood cells, and there may be several trophozoites per red blood cells. Schizonts, the large multinucleated cells formed from the trophozoite by multiple cells of nuclear fission, may be visible in the erythrocytes in non-falciparum malaria, but are very rarely seen in falciparum disease. Outside the red blood cells, oblong gametocytes, diagnostic for P. falciparum, may also be visible. What is the treatment of choice for this condition? Chloroquine is the drug of choice in the few areas where there is no resistance. Its major mode of action against Plasmodium is inhibition of the enzyme responsible for polymerizing heme. This results in the accumulation of free heme, which is toxic to the protozoan. Quinidine in combination with doxycycline or pyrimethamine sulfadoxine is commonly used as first-line treatment for chloroquine-resistant P. falciparum. Other effective drugs include mefloquine and atovaquone propranolol. What conditions provide protection against this condition? Sickle cell trait and glucose 6-phosphate dehydrogenase, or G6PD, deficiency both protect against malaria. The hypothesis that this increased fragility of the erythrocytes in these diseases does not allow for Plasmodium species to effectively replicate.